I am going to ask that we start by everyone taking a moment to mute their microphones, please. Thank you. And so welcome. So glad you could be here for our webinar. My name is Juliet Escobar, and I am leading the developmental promotion and developmental screening strategy in Best Starts for Kids. And I'll be presenting here today along with.
Hi, I'm Devon Love, and I'm part of the Help Me Grow King County team for Best Starts for Kids, and we'll be talking to you about that portion of this RFP.
So today our webinar is going to be about the current request for proposals that's open called Expanding Help Me Grow King County Partnerships to Help Support Families with Young Children. So during this time together today, we will have an overview, a brief overview of Best Starts for Kids. We're going to give you a review of this request for proposals. We're going to talk about technical assistance and additional resources. And then when we end, we're going to open the line for questions. For now, it would be great if everyone could just stay muted. If you have a question, you're welcome to put it into the chat box as we go along. And then when we finish the presentation, we'll address questions and open up the phone line. So starting with the vision for Best Starts for Kids, this is what guides all of the work that we do, and it's that we want to see babies born healthy, kids thrive, and young people grow up to be happy, healthy, successful adults. And so around here we say happy, healthy, safe, and thriving quite often. And the mission for Best Starts for Kids is to strengthen families and communities so that babies are born healthy, children thrive, and establish a strong foundation for life, and young people grow into happy, healthy adults. Best Starts for Kids recognizes that persistent inequities exist, especially by race and place, that in many cases are getting worse and threaten collective prosperity of families in our city and county. Best Starts for Kids is working to invest in organizations that are reflective of and embedded in the communities they serve, and those that recognize and address disparities and disproportionalities, as well as strength, assets, and ingenuity that communities possess in face of these inequities. And so we like to share this piece of the equity statement that was created by our Children, Youth, and Advisory Board, which really centers the racial equity and social justice work we do in the county. So these pieces of it are that equity is an urgent journey toward well-being as defined by the affected. Equity is disruptive and uncomfortable and not voluntary. And equity is fundamental to the community we want to build. So now I will share the principles that guide Best Starts for Kids programming and investments. We recognize the importance of increasing the good, decreasing the bad, and to intervene when needed. Promotion really begins before birth and lasts throughout life, increasing positive resources, relationships, opportunities, and environments. Prevention prevents things like stress, unsafe environments, or insufficient opportunities. We want to decrease the bad when we can. And with intervening early, we're able to support children and young people who need more resources. With policies and systems change, we are really working from the inside out to bring equitable access to our community partners. We're trying to mitigate barriers and remove past harmful policies that may be seen as business as usual. And so this shows kind of the outline of Best Starts investments. 50% of Best Starts for Kids funding is dedicated to the prenatal to 5 programs of investing early. And that's where this RFP sits. I'm just going to take a minute. If everyone could mute, that would be great.
I think it's *6.
Oh, *6.
I think it's *6.
Thank you. All right. So this RFP sits in the investing early portion of prenatal to 5. Best Starts for Kids recognizes that brain science shows us the positive return when investing early in young kids and setting them up with a strong foundation for health and well-being. Next is the Sustain to Gain, which is the 5 to 24-year-old programming, and also data and evaluation. For us, data and evaluation is really embedded with equity, and it's essential to the work that we do. And our colleague Sarah J. will talk with you about data and evaluation components of this RFP in just a little bit. And finally, the Healthy Communities portion holds our communities of opportunity work, youth and family homelessness prevention, and family engagement work. Now I'm going to turn it over to Devon, who will tell us more about Help Me Grow.
Thank you, Juliet. So what you see on the screens right now is a newly released flyer that we've developed for the work that we are planning to do in Help Me Grow for King County. This really sort of promotes our vision, which is that we want Help Me Grow King County to respond to our family, connecting us to what we need, when we need it, how we need it, for all King County communities. That's our vision, and it's sort of stacked with work that was done in developing the implementation plan for Best Starts for Kids from 2016. So in that plan, we wrote that we wanted to provide a new system of teamwork to support families and children by building on the strengths of communities through multi-directional communication and strong community and system linkages. So we're really seeing this flyer as how we're sort of developing that pathway that will connect these resources to families so that they get those resources in the time that they need them. We couldn't do this work without actually going to community and hearing from them about what their needs are. So throughout the year of 2019, and specifically in spring of that year, we worked with ethnocultural liaisons who actually provided community cafes in about 13 different community settings. And engaged with community members to really inform what they would see as successful for their families in this community. And so we heard a lot of things. We heard that there is this desire for consistent opportunities to connect with other parents and caregivers, as well as with the system at large. We heard from them that they really wanted to build relationships among communities and that they wanted to continue these conversations. There are a lot of aspects of those conversations that came out that we know we're not going to be able to address, but we're really looking to work with you in order to get to that and hope that we can make some system changes that will then positively affect all of the needs that we uncovered in these community cafes.
The developmental screening and referral strategy also went out to community to learn about priorities. We started with a long community embedded research project, which we're calling the landscape analysis. And following the landscape analysis, we worked with a group of 12 community experts who guided the development of a strategic plan on developmental screening and referral. We hosted 3 community conversations. We hosted a webinar, 12 focus groups that included parents, caregivers, and early childhood providers. And with all of that, we drafted a strategic plan. Throughout this community-guided process, we were able to identify 4 goals that ended up in the strategic plan, and that's what you see here. So goal 1, the most highly prioritized one, is to ensure coordination of early care, education, and healthcare systems so they quickly respond to families' needs. Also important was to strengthen the child services workforce. Goal 3 is to make developmental screening and services available and make them positive and ones that celebrate. And 4 is to drive equity by enhancing screening tools, practices, and referrals and services that really meet families where they are. As you can see, Goal 1 connects us with Help Me Grow because we know that we can't do increased efforts around getting more kids access to developmental screening without a stronger and responsive referral and resource connection. Which brings us to the structure of this RFP. The message was very clear from community. These efforts needed to happen in tandem to support one another. So we're combining both of our strategies into a single RFP. And which brings us to the quote, if you want to go fast, you go alone. But if you want to go far, you go together. And we're hoping that these efforts will lead to real dramatic systems change and improvement for our families.
That's right, Juliet. We really want this combined effort to have the most positive impact on our communities in King County. But for the specifics of the RFP, you'll see that the strategies are broken up into two different approaches. So the Help Me Grow approaches are approaches 1, and there are 2 focus areas. 1.1 is around a collaborative community-based organization partnership. So what we're looking for in this particular focus area is that CBOs who connect with families to resources and collaborate to expand Help Me Grow in King County. We're hoping that these CBOs will have some work that they've done around connection and referral or building a resource directory. We're looking to really work with and maybe massage some data that's been collected from clients and really want this to be a collaborative partnership. For this particular approach or this particular focus area in this approach, we will be providing a convener that will actually facilitate the partnership. So we'll be working with all of those who are funded under this approach to collaborate together and share their expertise with one another. And then there is focus area 1.2, which are our family connection pilots. So these are really to work with expanding or recreating or beginning any of those partnerships or methods of working with community that results in a warm connection that is experienced through person-to-person connection. We're really looking to enhance the way that families actually experience the receiving of services. So we want to make sure that whoever is funded in this particular focus area is able to connect with families and then make sure that they can connect with resources in a way that helps those families navigate the resources in the best way possible. And then, of course, results in a positive connection that will help to make those families thrive and everyone appear healthy or get to be healthy here in King County. I'd also like to say that with all approach 1 funded areas, we will be facilitating opportunity for those funded to actually collaborate and interact with one another. So again, that convener that we've mentioned will work with this. And in addition, we'll be working with the state affiliate for Help Me Grow, which is within reach, and who is a partner of ours and has been helping us to develop this sort of system as we've come to create it here in King County. They're an integral part of this work and will be partnering with us as we continue to develop this strategy within King County.
The approach 2 really focuses on the findings from the research we did with the landscape analysis and the strategic plan around developmental screening. So in order to realize our vision that all King County children and families receive high quality developmental screening throughout early childhood, that centers each child's and family's strength and seamlessly connects them to appropriate, accessible, and timely developmental supports. Really, we have lifted up these 3 focuses within this approach, and these are the 3 focuses that were most important to the community members that worked on this with us. And I will tell you about each of them now. So 2.1 is going to be about developmental screening and referral programs overall. So based on what the community told us, examples could be like creating new options for families and children to access screening in new ways. It could be screening and referral innovations that celebrate progress, that have a strength-based approach, work towards screenings being routine and strength-based and really parent-led. increasing emotional and mental health supports and optional screening for parents and caregivers to access. And of course, education and messaging to reduce stigma, to even allow these events to take place and these conversations to happen. By doing this, we hope that we'll realize the goal of making developmental screening and services that really celebrate progress available and accessible to all families. More specifically, focus area 2.2 is about the workforce. We heard loud and clear that the people caring for our children and working with families deserve more supports and access to skill building. So the focus of this one is really to strengthen and transform the workforce and the organizations who provide the care and supports. Examples of projects for this could be building knowledge about child development, screening and services that are available, to recruit and mentor community members who have resonant lived experiences to join the early care education and healthcare workforce, and really to create pathways for them to access leadership. And something like training, coaching, evaluating providers and interpreters on the use of soft skills and the development of skills like cultural humility, implicit bias, trauma-informed care, strength-based counseling, motivational interviewing, and really to enhance the workforce by offering trainings that are accessible and resources that could be through remote learning, on-site trainings, trainings outside of regular workday hours, plus many more. And then the third focus is to address kind of the age-related service gap that sometimes happens around age 3. We heard again and again from families that this artificial divide of services and programs at age 3 is very hard to navigate. One family reported that even though their transition from early supports for infants and toddlers or early intervention to a school district was supported by their provider, the difference in services felt like being dropped off a cliff. To address that, we are opening the opportunity for programs to be innovative that either support navigation between early supports and infants and toddlers and school district services, or offer case management and supports for families who are trying to connect the programs at age 3, or programs like the Seattle Developmental Bridge Pilot, which is a brand new pilot that's really just taking early intervention and early supports for infants and toddlers type services and extending it for children who have either aged out or who were referred too late until they are able to complete a warm connection into their next steps.
So who is this RFP for? This opportunity is open to a variety of different folks. I think the most specific thing to note is that we want you to be serving communities in King County. It is King County funding, so we're looking for organizations who are nonprofits, community-based organizations, tribes and tribal partners, schools and school districts, medical clinics, and public or governmental agencies. All are welcome to apply for this RFP. And I'd also like to note here that partnerships are definitely encouraged. So within approach 1 or 2, I think partnerships are welcome, and we really look at that. Next slide. So here's, I guess, a basic summary of what the funding pot is. It's around just under $7.5 million that we're releasing through this RFP. About 3.6 of that is for approach 1, and 3.85 of that is for approach 2. The funding limits for approach 1 are $300,000. The funding limits for approach 2 are $350,000, and if you did a combined funding request, it would be a limit of $400,000. As you know, the RFP is open. It opened on February 13th. The application due date is March 31st of 2020, and will close at 11:59 p.m. I'd also want to just stress here that the way that you apply for this RFP is through Zoom Grants. And so that's www.zoomgrants.com, excuse me. I'm going to start over. ZOOMGRANTS.com. You can go there and you can find the expanding Help Me Grow King County RFP and then respond using the questions in the format within that form. We expect that contracts will begin around June 1st. That's the date that we have. We are the county, so sometimes things get in the way, but we anticipate that this will be about an 18-month contract and are hoping to fund between 18 and 24 entities for this work. Next one. So here's another timeline. I've gone over some of these items of detail, but I want to highlight a couple of other opportunities for you all. First, there's 2 info sessions that we will do, one on February 28th and one on March 3rd. We'll come back to those and give you a little more detail a little bit later in this webinar. The last day for you to request assistance from the technical assistance providers is March 24th. But I would encourage you guys to reach out to them much earlier than that, just so that you can get all of your ducks in a row and make sure that you've got everything that you need to submit your application upon closing of March 31st. The last time to ask questions through the Zoom Grants portal is March 26th, and I will do my best to respond to those within a period of 48 hours. And then we'll move on to having those RFPs that were submitted by that close date of March 31st, 11:59 p.m. We'll do that review between March 31st and May 5th. And then we'll have some notifications that come out after May 5th and do some contract discussions in May with the, again, potential start date of June 1st. I'm going to now turn it over to Sarah J., who's going to talk to you a bit about evaluation.
Thank you, Devon. My name is Sarah J. I'm a member of the Best Starts for Kids data and evaluation team in the health department here at King County, and there's 2 things that I'm going to briefly cover today. One is just some ideas and resources around including data in your proposal, should you choose to submit one in response to this RFP. And the other thing is to give you a heads up on what to expect around evaluation if you are indeed funded through one of the approaches in this RFP. So our data and evaluation team has 3 guiding principles that we hope you will see reflected in our work together, which are partnership, collaboration, and accessibility. So to get started, let's go ahead and dive in to think about using data in your proposal. I'll say this again, but really take a good look at the criteria that are included in the RFP and think about what is the story that you can tell about your organization's strengths or your program idea's strengths in meeting those criteria to meet the common goals of this RFP. And what's the story that will help reviewers understand what you hope to do and why you believe you can really be successful in that. When you have the story in mind, think about what kind of information will help back that up and make it concrete for reviewers. We have a diverse group of reviewers and they don't share all of the same context knowledge. They don't know everything that you know about your community. So the more information that you can provide to really paint that picture for them, the better they will understand what you're hoping to do when they read your proposal. So when you think about what's that kind of information, what data will really help make this concrete and communicate it to those reviewers, then you can start looking around for that information. And we'll talk about a couple sources for that. So when we say data, what do we mean? There's many different kinds of data, and I'll show you some resources for numbers this afternoon. That's very often the first kind of thing that comes to folks' mind, but it's not the only kind of data, and it's certainly not the only kind of data that will be powerful and convincing to reviewers, or the only kind of data that Best Starts for Kids values. So, pardon me. you can think beyond the numbers, especially when there's limitations in the numbers. They're not maybe as specific to your community as what you're ideally looking for, or not specific to the topic that you really want to focus on. There's stories, there's pictures, and including maps. Those can all be really powerful kinds of data, and pairing them often can be even more than the sum of the parts. A number might give information about the breadth of an issue. So, like X% of folks in this community are experiencing something, but the story really gives it the emotional impact, and gives reviewers a sense of the depth of what it means to experience that. Just for one example. So when we say data, we don't just mean the numbers. Please feel free to think creatively. King County has many data resources that we are sharing. Many of these are linked directly from the RFP, and we're including those because we want to eliminate extra work on your part if you do decide to go looking for that kind of data. And so that everyone kind of has access and the same knowledge about what's out there. The intent is not to dictate the data sources to you, or how you might want to use that data to tell your story. We really do value different kinds of data, not just our own data, and really encourage you also to contact a technical provider for support around this if it's something that you have questions about, or that you're trying to figure out, like, where can I find the data? Is there any data that can really help my application? That's something that they are well prepared to help you with. So with that being said, some of the resources available from King County include Communities Count. This has some information about between 30 and 40 different social, economic, and health indicators for King County. We break it down as much as we can by geography. Some are neighborhood or city specific, as well as different demographic groups like gender, race and ethnicity, language spoken at home. There's very real limitations to what we have, but we share it as much as we can. Communities Count is also a great place to look for other data. There's a long page with links, so if you want different kinds of data, educational data, environmental data, we've got tons of links there. And it's also great if you consider yourself to be a bit more of a words person than a numbers person, because each chart or graph that you see will have a paragraph just outlining some of the key bullet points. So if that makes it easier for you to access the data, that might be helpful. Then again, if you've taken a look at the RFP, you will note that we ask you to say how your work is related to the Best Starts for Kids indicators, and I'll dig more into that in just a moment. But then finally, I do want to acknowledge that there's a lot of data that could help you tell your story, or that could be relevant to the work that you want to do, that we don't have here at King County, and that's no reason not to include it in your proposal. Sometimes when we don't have something available at the local level, you might still be able to find it at the state or national level, especially like if there's an advocacy organization specific to your work or your community. That can be a great place to look, and it's totally fine to say, we don't have this for King County, but we know that this is what it's like in a broader scope. And then also think about your own data. You probably have data from programs that you've done. You have stories from communities that you've worked with. All of that can really help flesh out and fill out the story for reviewers who might be taking a look at your application. So I mentioned the Best Starts for Kids indicators. This is a part of the Best Starts for Kids evaluation that we are looking at what's happening at the big picture level at King County overall and for specific communities. So these are the things that we really hope that collectively across our many different programs and strategy areas that Best Starts for Kids can help contribute to moving the needle on. So it's not anything that any one program is held accountable to changing, but it's those population level, big picture things that we want to see. How are these changing? And you'll find things there like what % of kids had access to a developmental screening, what was kindergarten readiness look like, all kinds of different stuff. If you would like to have a brief little tour and some tips about navigating this data, Please let us know, type it in the chat box, and I can do that during the Q&A after we get through the PowerPoint presentation. But there's tons of stuff in there. It's designed to be relevant to the work of Best Arts for Kids because that's why we created it. And we do, again, disaggregate it, break it down into more specific geographic groups, race, ethnicity groups, stuff like that as much as we can, although, again, there's limitations. So if you have questions about that, please do let me know, and we can poke around there during the Q&A if that would be helpful to you. So moving on to evaluation, if you are funded. All programs that are funded through Best Arts for Kids do participate in performance measurement and reporting activities. So it's something you should plan on working on if you're funded. But that being said, an evaluation plan is not required as part of this proposal. So you don't need to worry about developing that at this stage. Just know that it's something that we will work together on if you are funded. And then again, where feasible, we'll coordinate with other data collection so that we're not unnecessarily duplicating efforts. So when we think about performance measurement in Best Arts for Kids, there's 3 basic questions that we think about. How many people were served or reached or impacted by this program? Secondly, how well did we serve those people? And thirdly, how are they better off? So again, you don't need to put together an evaluation plan at this point, but think about how you might measure that. And that's something that we will be working more on for projects that are funded. And that's some of what their reporting will look like. So different types of data that you share with us will have different processes and timelines. Narratives, that's like the story behind the numbers, if you will. Most programs submit those to us every 6 months, and there's 5 basic questions that we ask about. What, if any, changes have you made to your program? What successes have you experienced? What's been challenging? Have you made any change in the policy, systems, or environment level? And is there a story that you'd like to share with us? So it's pretty straightforward, and those we collect every 6 months in June, July, and January. And then there's the numbers that I'll talk a little bit more now. And this will be different between the 2 different approaches that are included in this RFP. So if you are funded under Approach 1, those groups will be helping to shape what that data sharing system looks like. So that's something that will be developed with input from those funded under Approach 1. And that we can't say exactly what that'll be yet because it doesn't exist, but know that you will be sharing data with us and have the opportunity to give your feedback onto how that process goes. For programs that are funded under Approach 2, you will be required to report client level data to King County via the Department of Community and Human Services online reporting system, which is called Client Outcomes Reporting Engine, also known by its acronym CORE. So CORE is an online portal where you submit your data securely, and the data elements are standardized if you're part of any other funding strategies from King County across 4 different initiatives. So I see there's some acronyms here. That's the Department of Community and Human Services initiatives. They include the Veterans Services and Human Services Levy, Best Arts for Kids, what we're here talking about today, the Mental Illness and Drug Dependency Initiative, and Developmental Disabilities. So if you're part of any of those initiatives, you might be a little bit familiar with CORE already. So oftentimes people ask, why do we need to submit client level data? And there are some great benefits of sharing this. So you have the ability to disaggregate by race, gender, age, and other important demographics to answer questions like who's being served, how could we collaborate better, who aren't we serving? And we can do that at the big picture level across different programs as well as within programs when we have the opportunity to put together that client level data. It helps us understand which different programs serve the same clients and identify opportunities for collaboration. And it helps us analyze trends and generate ideas for serving clients more effectively, again, across different programs and levies. So your evaluator will be working with you to help you get set up to submit that data, and it will typically be through a spreadsheet. This is an example of what that looks like. So it'll be something that you would upload to either Core or the system that will be developed for partners under Approach One, and you'll have access to the same dashboards and instant data validation that we have access to here on the King County side. So I think that's it for data and evaluation for now, but please do let me know if you have questions, if you want to take a moment to have a little demonstration of the Best Starts for Kids indicators website, and I'll hand it back to Julia and Devon.
Thank you, Sarah J. So a lot of really great information about data and evaluation. Of course, something that's integral to all of the work that we will do with this program.
So the same rating criteria is used for both approaches and for all applications that are submitted for this request for proposals. That's been provided for you in the Zoom grants in the RFP. And we just like to remind everybody to carefully review the rating criteria. The review panel will follow this closely. All proposals submitted will go through a formal review process, and there is an appeals process that's outlined in the RFP for you. And as you probably know, we offer free technical assistance to support organizations and eliminate barriers that might prevent them from seeking funding. As Devon mentioned earlier, getting in touch early is highly recommended, even while you're still forming an idea to propose. Don't wait until the end of the application period. And these are just some of the questions that a technical assistance provider can go over with you. So, is this program a good fit for my organization? Which approach should I apply for? Am I asking for the right amount of funding? Am I writing clearly and persuasively? And much more. Some additional resources. We have 2 more information sessions in person. This webinar will be posted. We've also included a glossary of terms for some relevant definitions at the end of the RFP, and a checklist to make sure you've submitted all of the pertinent pieces. And so we are going to now take a look at some questions that have been put into the chat box, and open up phone lines for questions from you all as well. Okay.
All right. It looks like we don't have any questions in the chat box, so we'll open up the phone lines. But I did want to iterate one other thing about some grants. You cannot submit your application unless all of the questions have been answered. So make sure that you do double check and make sure you've answered all of those questions before you hit that submit button.
Thank you, Devon. We will, as questions come along throughout the RFP period, we will be putting perhaps weekly frequently asked questions that will be viewable for everybody who is applying and signed into Zoom grants. So as you think of questions, you're welcome to submit them through Zoom grants. Okay, we have a question about some core data.
That's going to have to be answered by Emily.
Yeah. We don't have the details to answer the, let me see.
I don't know if we can.
Okay. What is the scope for client data required for a push? So as Sarah J talked to you about client level data that is required to go into our core data system for those who are funded under Approach 2, which is by the Department of Community Human Services. The information we have is what we've provided right now. We don't have further detailed information on that, but if there is a specific question on that, please do submit it through Zoom grants, and we will posted on the FAQ. I anticipate it being a topic that we touch back on.
Yeah, I will say for sure the standard demographic elements include age, gender, race, ethnicity, and geography, for example, zip code of the clients that you're serving, if that's helpful to know. Like there's another question coming in from the chat box. As far as eligible budget expenses, will there be guidelines on what Help Me Grow wants to see people requesting funds for as far as personnel and project expenses?
That's a great question. I'm consulting with staff in the room, so give me just a moment. I don't think we specified anything in particular around it. So while we're getting a response for that question, we're going to check to see if there's any others. I see another one. I hate to lean into the screen like that.
Okay, so there was a question about looking at the BSK indicators, so maybe we can do that after you answer the next question. To the extent that 0 to 6-year-olds' quality of life, behavioral, and developmental health are dependent on a strong, healthy families, is a resource navigation and supportive services strategy, a wraparound strategy, ideal for this RFP?
Yeah, I think if you explain the case for it, that is compelling, then that is definitely something to be considered.
Yeah. All right. No, we didn't unmute people yet.
Can we unmute people? So, because some people are recording. Is that a yes?
So at this point, we also are going to go ahead and unmute the audience. Just please be mindful that if there's a lot of background noise where you are, you can go ahead and put yourself on mute. And I do see that some more questions are coming in, but I'm going to go ahead and respond to the request to take a look at the Best Starts for Kids indicators here. So the other question, maybe you guys can start chatting about this. We're an emergency shelter that serves families. We partner with another organization to come in and do developmental screenings. Would that be eligible to be funded through this opportunity?
Sure. I would say it would be really interesting to sort of flesh out what would make this a stronger, more comprehensive screening program at an emergency shelter. But yeah, that's definitely within the scope.
Okay, I'm going to request control. You can give it to me now. All right, so can folks see my screen? I hope. Should be a website that says Best Starts for Kids Indicators. So these are organized, as you can see, into the 4 different strategy areas of Best Starts for Kids on prenatal to 5, probably the most helpful ones for this one, but maybe not the only ones that you want to look at, depending on your program. What you'll see when you land on this page is the table of contents, and it will show you the indicators based in these topic areas. If you would like to just select, maybe you can say, I know that I'm really focused on prenatal to 5. You can have a shorter list to navigate. If there's something specific that you're looking for, you can also go ahead and type in here. I will caution you that unfortunately when you search, you will only see results that have that specific word in there. So if I type in kids and something says children, it won't come up. So if you're not seeing what you're looking for, try using just like the root of a word or just even scrolling. So I'm going to look in here, like what data do we have around developmental screening? And I see that that is an indicator here. And when you click on an indicator, it will take you to a page that has an interactive visualization or a set of charts and maps with information responding to this. So the first thing you might often see is a map. And this actually is from the Best Starts for Kids Health Survey, which is parents of kids 5th grade and younger across King County. And overall, in King County, the first time we did the survey in 2017, only 21% of kiddos had actually had access to a developmental screening. And it's a little bit different. We see it's actually a bit lower in Seattle than in some other parts of the county, which is interesting. But if you're interested in more than the regional data, be sure to click on this demographics tab. And that will give you a lot more opportunity to dive in. So you can see the child's gender. Results are not wildly different there. It's a little bit hidden, but normally you'd be able to see on this sidebar some more information about what the color codes mean. If you want to really narrow it down, you can just select the ones you actually want to look at by checking or unchecking the boxes on this list. So again, we've got information by race and ethnicity. Sometimes, we really are limited based on how data is collected for different indicators. You might only see these basic categories, but sometimes when we are able to, like the Best Starts for Kids Health Survey, BSK did that ourselves, and we said we know our community wants a lot more detailed level data than that general race ethnicity category. So you can break it down even further for data that you might find from the Best Starts for Kids Health Survey. We've got family income. We can see that in this case, it's a little bit different than what we see with a lot of other indicators where kids in low-income families are not necessarily less likely to have access to this service. Again, regional differences. We've got language spoken at home for the top 6 languages in King County. I know there's many more languages. Respondent's age, in this case, that means the parent, how old is the child's parent who took the survey. Respondents' gender, sexual orientation, education, and overall health. So what breakdowns you'll see, it all depends on where we get that data from and what we're able to show, but we do try to break it down as much as possible. I'm going to take a moment to show you as well something that you'll see a tab called Custom Demographics. This is if you really want to narrow it down. So let's say I'm really interested in, I'm looking at the South region, and sometimes you can choose as well. Let's see, I'm going to choose race, ethnicity, and see, like in my area, what are any potential disparities going on. So you can poke around with that custom demographics tab as well if you want to really narrow it down based on 2 different factors. And then again, depending on what data that you're looking for, what we have access to, you might find trends or a more detailed neighborhood map as well. But that's the short version of the Best Starts for Kids indicator data tour. Is there anybody who has questions about that before I stop sharing? You should be unmuted as well if you're on the phone, so you feel free to chime in as well. All right, I'm going to hand it back to Devon and Juliet and Yvette. And I don't see any more questions that have come in, so please take a moment if you do have a question and let us know.
Thank you, Sarah J, for that demo. I hope that was useful for all of you. I'm going to just circle back to the question about the budget for Help Me Grow. So I'm not sure if you've seen the RFP already, but just wanted you to know that there is a budget that's provided. So in Zoom Grants, you are able to fill out a template for a budget. I'll iterate that that budget is not scored as a part of your application, but it's used as a guideline for you. And what I would say in response to the question about personnel is that we're just looking for making sure that staff is equitably paid and that your expenses are covered. So if those are things that you can detail within that budget, then that's what we're looking for around that topic. All right.
While we have a moment, I wonder if any of the TA providers are on, if they wanted to introduce themselves.
You might need to unmute yourself.
Yeah.
There's a question that came in. Will there be more info or examples of types of programs of interest for funding under Approach 2, or should we use a consultant? Yes and yes. I definitely seek a consultant, but I think there's sparse information on the types of programs recommended because we really want to hear what you find as a good solution to the service gap. So we're recognizing that we don't have all the answers for exactly what needs to happen and what needs to be funded. And so we're really looking for innovative, community-driven approaches.
Are there any other questions that people have? If you're muted, I think it's *6.
Yeah.
That you can use to mute and unmute. So try that.
Hi, this is Roxanne Hood-Lyons. I'm one of the TA providers.
Right.
Thank you, Roxanne.
Hi. Hi, and I just want to underscore everything that you've said. Thank you so much for the great presentation. And to potential applicants, contacting a TA provider sooner rather than later is a great piece of advice because many of us get very busy very quickly. So we want to be sure to help everyone that needs it. So contacting us early in the process is a good way to do that. And we're happy to help. We love doing it. So reach out.
So in the chat, one person shared, we're thinking about how to craft a proposal that will allow us the vital capacity to be a bridge to our community. And I think that's definitely capturing the spirit of what we're hoping to see. A point I know that we mentioned, but just to bring it up, as you're thinking now about what kind of programs we could possibly create, is that our contract period is expected to be June 1st through the end of 2021. So that's going to be an 18-month contract. And so recognizing that it may take a quarter to get up and running, to get staffed up and going, what can you reasonably propose to do within that time frame? Here we have a question. Do we need to have an MOU in place or evidence of commitment from strategic partners for this application? And at the point of application, an MOU is not required. However, if you are going to mention working with another partner in your application, that partner should have given the green light and should be aware and on board. But we will not ask for an MOU at the point of application. Really great question that I wish I had a great answer for. It came in. Given the 18-month contract, do you expect us to find capacity to fund the work post BSK? Of course, we're hoping that post BSK won't be a thing, but until the levy is on the ballot and renewed, we just cannot contract beyond that point. Yeah, as we really very lightly touched on it in the presentation, but we've mentioned that there's approach 1 and approach 2, and there's the possibility of approach 1 and 2 merged. And we really encourage anybody who would like to propose a program that combines the approaches to just seek some guidance from TA. We recognize that the approaches do fit together well, and there likely will be proposals that combine approaches. And our TA providers are ready to help think through those details with you.
And I also would encourage you to reach out to the TA providers in case you wanted to work with another organization on your proposal, because perhaps there's another organization that's seeking a partner as well. They might have more information about linking you all together and can help support that.
Thank you. That's great.
Yeah.
And then we have, will this funding be renewable over multiple years? And our hope is yes, until we have our initiative refunded by the levy. We can't say anything beyond 21, so we hope to know soon.
Yeah, I guess just to provide a little more context, just in case anybody on the webinar is not aware, Best Starts for Kids is voter funded, and it was a 6-year property tax levy that was approved in 2015. So voters will have the opportunity in 2021 to vote again on whether they would like to renew that funding source. And that's why Juliet's referencing, the end of 2021 is the longest commitment we can make, because it will be up to the voters of King County. And we won't know how that goes until it happens.
Thank you, Sarah J., for the additional context. Very helpful. But do know that we recognize in 18 months the kind of systems change and work that we're really hoping to see. We don't expect it to get off the ground and completed in 18 months, and our intent is hopefully to have programs that are renewed.
Hi, this is Roxanne Hood-Lyons. I'm one of the TA providers.
I'm sorry, can you speak up?
Hi, yeah, sorry.
Let me try my speaker.
How about that? Is that better?
Yes, thank you so much.
Yeah, sure. Hi, this is Roxanne Hood-Lyons. I'm one of the TA providers. And I got a great question from an organization yesterday who contacted me. And they're wondering if you have an idea that a program structure, a coordinated set of services is going to be ongoing for 10 years or 15 years, you set it up in a particular way. But if you have an idea that a structure that you're working on may only be viable for 18 months, you set up a different kind of structure. Mm-hmm. And so I wondered if you could speak to that a little bit. What about the size and the scope? What kind of size and scope are you imagining organizations could effectively create given the timeline?
Yeah, I think we have to just stick with that 18-month.
And so, yeah, Donna was saying that we have to stick with the frame of reference of an 18-month project. And so we are encouraging something like a pilot, an innovative approach that maybe you wouldn't want to invest 10 years in, but you might want to learn from in order to make a better longer-term decision. So this is a really good opportunity to try something innovative and new. And in your application, in the proposal, please, we are interested in your long-term thoughts and ideas about how that would play out, but we just can't set up that kind of program right now.
Right.
Thank you.
So we're still monitoring the chat box in case you didn't want to verbalize your question. But the lines are open. So if you do have questions, please feel free. But I also would just, again, promote the 2 opportunities for the information sessions that are in person at Bellevue Library on February 28th and the Federal Way 320th Library on March 3rd. Those will be additional opportunities for you to come and hear this spiel and possibly ask additional questions if you need some time to think it over. But as always, your TA providers are open and welcome your questions at any time.
That's true. We love doing this work.
This is a great question from Marnie. Hi, Marnie. Would an organization applying for funds in Approach 2 need to address 2.1, 2.2, and 2.3, or can a proposal include only one of these sections? So any of the above, it can include all of it comprehensively, or you can focus in on just one of those focuses for Approach 2. So if you wanted to just focus on workforce and training, or if you wanted to just focus on a transition support program, that is completely fine.
And I'll just iterate that on Zoom grants, it asks you to pick one of those or all of those focus areas for you to choose on, but it doesn't say that in the paper version of the RFP if you print it, download it and print it that. So you do have the opportunity to select which area you're going to focus on when you're in the electronic version of the grant application.
Thank you.
Mm-hmm.
Would you mind addressing how you see this marrying with an ESIT program in a little more detail?
Looking at me, huh? Okay.
Mm-hmm.
It's a great question.
You've done more work with ESIT than Help Me Grow has at this point.
I think marrying is really a great way to describe it. We know that an increase in developmental screening leads directly to an increase in children receiving more services through early supports in infants and toddlers or birth to 3 early intervention. But we also know that families need comprehensive referral and resource connection supports to get there. And so I think when I think of an early supports in infants and toddlers provider, I think they have a lot of the necessary ingredients to greatly affect both Approach 1 and Approach 2. And I think, there isn't a certain focus in either of the approaches that I think would be best for an ESIT provider. I think that they're all really accessible to anybody working in birth to 3.
So I see a question that has come in that seems to be specific to Approach 1, Focus Area 1.2. They're asking how risky is a new pilot strategy? And I think all are risky, but what we're looking for in this particular area is the expansion of or the beginning of any family connection pilot. So if you have any experience that really has worked to provide warm connections to families in your organization through a program that works to strengthen the navigation that those families are able to do with locating resources throughout the county, then I think you could certainly write to apply for funding that would support your work in that field. Thumbs up, yay. Yeah.
Hi, I have another question. This is Roxanne again. On 1.1, if there's a somewhat isolated geographical part of the county and partnerships come together in that particular area to create sort of a localized, connected set of resources, that is as viable as someone trying to connect across the county, is it not? Or do you prefer the localized, smaller, I don't know if prefer is the right word, but if you will be leaning toward the more localized, smaller areas, smaller corners, or will you be looking more for opportunities to connect someone, for example, in a small, out of the way area with people in the city, for example?
I would say that our goal is to have King County work, or excuse me, Help Me Grow work King County wide. So I think both approaches would be fine. I wouldn't say that we preference one over the other. We know that there's a lot of areas in King County that are in fact lacking access to resources or don't have very good methods for making connections. And certainly, I think, encourage organizations who feel like they can make an impact in those areas to apply, because that's something that we look forward to seeing. And as I'm thinking a little bit more about that, Roxanne, I think I'd also iterate that we've mentioned that this will be a partnership that's facilitated by a convener that we're going to work with here at King County. And so it just encourage whoever applies, if funding does get extended to that entity, to participate and let us know what experiences you're having as far as your ability to access and really connect your families to services in those areas. That would be an important aspect of the work that we'd like to be able to build upon as we continue and hopefully work through maybe an additional iteration of Best Starts for Kids.
So I think that's Devin, yes? So are you suggesting that that the county is looking at this as a learning opportunity, the coordination and getting the groups together also, in addition
Yes.
to the organizations, of course, would learn and connect with one another, but you're also looking at it as a learning opportunity for the county to have deeper understanding of where we're lacking services across the county.
Definitely.
And how we can improve. That's great. Thank you very much.
Mm-hmm. 5 more minutes. Okay.
I'll ask one more question since it's quiet. This is Roxanne again. Sorry, you can mute me if I'm asking some questions. I'm wondering about the where to find the information from the cafes that we might want to read and understand. Is there a? Can you? I was on a phone and not on a computer, so I didn't see that. If you did show a link, I wasn't able to see that. Did you show a link during the presentation, or is that something you can maybe send me an email to help me find it?
What we can do is, sorry, there's an echo and it sort of, it triggers me. But we will work to ensure that information around the cafes is uploaded into the Zoom Grants portal. So there's a section in Zoom Grants called the library, where you have access to a hard copy of the RFP, as well as the rating criteria, or the glossary is separated, and some other documents that you'll need in order to complete your submission in Zoom Grants. And we can make sure that along with the FAQs being uploaded to that section, we can add a summary of the cafe harvest.
Would you mind
Thank you.
pulling
That's
up our
super helpful.
visual? I think we sped through it during the presentation, and maybe that would be good to marinate on a little bit. Thank you. So I'm just taking us back to how we've tried to frame the structure of this RFP, not structure with a capital S. It's really just a visual to help us understand the connections between the Help Me Grow work and the screening work. And so in the green circles, those are the focuses in approach 2 that will be funded by Department of Community and Human Services through my work. And in the brown circles are the ones that are going to be funded under the Help Me Grow umbrella with Public Health Seattle, King County. So it says loading. The slides are not visible. Okay, some see and some do not. Okay.
They will be posted on the blog. So if you want to review them later,
Thank you.
Opportunity.
Okay, so yeah. Sorry if you're not able to see it right now. This will come up on the blog.
Last few minutes for any final questions.
So again, especially in the green circles, you'll see in the italics some sort of examples of programming options, and I really just don't want people to feel limited by what is there. These are sort of seed ideas to get started, but I want to hear from you. I want to hear what's going to be a useful and effective approach for your community specifically, if they're not being reached well already by systems in place. So we're not just trying to make more of the same. We're trying to really have an equitable approach and reach those who are not being served well.
And I would say the same goes for approach 1 in focus areas 1.1 and 1.2. 1.1, we're really looking for resource networks, a bit of data collection, but still certainly submit an application that aligns with your work. And we'd be excited to see and review that as well in an approach area 1, focus area 1.2. We're looking for anyone who serves as maybe a cultural navigator or ambassador or parent coach or community health worker. Those types of positions are positions that we see who have done some work around this warm connection type of work. So if your organization funds something like that, might be worth it to sort of submit an application in that area as an example. But I wouldn't limit to either of those 2 examples for those approach area 1. Certainly, again, please submit something that's maybe out of the box that we just haven't been able to think about, but definitely make sure that families are getting connected to resources in the county.
Well, I really appreciate everybody joining us for our presentation and asking excellent questions. Super excited to see what comes out of this and all of the amazing work that's going to start this summer. Please, come to our info sessions, check out the FAQs that we'll be publishing in Zoom grants. We are just really super excited to engage with you and get this going.
Thanks so much, everybody.
All right, bye-bye.
Thank you very much. Have a good day.